Doug was like, hey, I know that guy. He was on Fox News talking about trying to legalize cannabis for veterans. Let's get him on. And I was like, yes, definitely. Let's do that. So where are you guys on the road of, like, how long ago did you start this? What got you into it? As an ex-Navy SEAL, being pro-pot, I mean, under the covers, that's becoming very acceptable now because, a lot of guys are finding improvements with PTSD and their psychological issues and being able to deal with anger and stuff like that with cannabis therapies. What got you into this? Tell us your story.
Sure. Well, and first of all, no surprise that Doug and Ben are in need of and are seeking psychological improvement. So I'm curious how that's going for them. No, I appreciate the question. I appreciate the question, Sean. So I was in the SEAL teams out of the East Coast and the West Coast with Doug and Ben, deployed to Afghanistan and then Southeast Asia as well. And when I left the SEAL teams in late 2015, was getting a graduate degree at Stanford Business School. And a classmate of mine, a fellow special operations veteran, was falling victim to, I would imagine, the stuff that you guys have seen. If you're interested in this topic, it's stuff that we're seeing all across the country, sadly. Veterans are twice as likely to die of an opioid overdose than the rest of the population. This year's veteran suicide number was the highest it's been in 5 years, according to a release from the Pentagon. So I had a friend, another special operations veteran, who was becoming one of those statistics. And I was involved in this person's healthcare, and he said to the doctor, hey, look, doc, I am absolutely fed up with the opioids and the other drugs I'm being prescribed. A classmate of mine as well. I can't focus in class. I feel like I'm becoming dependent on these drugs. I hate the way they make me feel. And frankly, I'm just depressed and pissed off all the time. I imagine, Sean, as you said, like, this is something that is not unique to my friend. Like, it's becoming more common than uncommon. So I'm involved in this healthcare, and this person says, hey, doc, I'm going to give this medical marijuana thing a shot. Could you just tell me sort of how much to take and where I should get it and what's the best way to do it? Like the same question you would ask your doctor for anything, right? If it's Tylenol or Benadryl or whatever, like, how much do I use? Where is it safe? And the doctor said, like, well, we really don't know. I'm kind of sitting there and I'm like, wait a minute. Look, hang on. Let me just interject myself. The federal government says it's, Jeff Sessions says it's the same as heroin. But here in California, you can get it delivered to your driveway, and they're saying it cures epilepsy, PTSD, Parkinson's, cancer, menstrual cramps, which I know have plagued Doug for a long time, and everything else under the sun.
Empirically.
So wait a minute. What do you mean you don't know the answer?
Yeah, that's preposterous. You're supposed to be the most educated medical professional. How do you not know?
Like,
what the fuck is that?
You don't have to promote the stuff, but come on, dude, you got to know the answer, right? And he's like, no, I'm serious. We don't really know. And I'm like, now I know you're messing with me because this is impossible. We know everything about most things about most other drugs. And he goes, well, the fact is, as a doctor and a scientist, I am beholden to federal law. So what that means is and cannabis is a Schedule I drug, as you guys know. So I can't go to a dispensary and purchase it or touch it or study it and get back to the lab or hospital. Because if you're going to study it, it has to come from someone who is authorized to produce a Schedule I drug.
Wow.